So it's 10 o'clock.
It's 10 o'clock. Yes, welcome everybody. We'll wait 1 minute to start. Let's imagine we are together in the one big hall of, for example, ICE in Kraków, what we hope to have, and we'll start. My name is Kazimierz Murzyn. I'm Managing Director of Life Science Kraków Initiative. Welcome to Kraków, Life Science Kraków. It is my pleasure to welcome you again, despite the situation we have been posed in this year, from the beginning of this year. It is, however, to be stressed that this very special situation calls for even more action in terms of collaboration for the health and the quality of life. Therefore, we have to asking ourselves if we should continue this presentation, this conference. We ask ourselves, paraphrasing, if not now, then when? If not we, then who? And then we decided to go again and continue this year and possibly, hopefully, next year's as well. Not to take you away from sessions you are mostly interested in, I'll just like to stress how this is being organized. And actually, we wanted to organize this the same way as we did it previous years, with one exception, which means there will be the thematic sessions organized in the way that you'll be able to participate in the sessions of your choice and have the rest of the day for yourselves during the week. There is already a marketplace where you can showcase your products, your services, your products, your projects, and invite people to collaborate with you, meet with you, especially there on this marketplace. And there is also partnering functionality when you can meet face to face with the peers you want to talk to. The only exception is that we don't have this year the inspiration session, but I hope that the sessions and introductions to sessions will be very inspirational anyway. So you will be happy, or not unhappy because of that situation. We'll not dance this year, of course, but you'll welcome next year. For next year, we'll prepare something very special in terms of inspirations. So thank you for joining us. Thank you for being with us on this program, and I think you will take home or get sitting at home what you really wanted to get from, what you always get from Life Science Open Space. Before giving floor to the first leader of the session, digital health session, to Karolina Tkaczuk, I have to thank you to all participants and all especially partners who helped us to develop and organize this event. I will not name them because there's quite a lot of them, and they are all listed in the Life Science landing page, Life Science Open Space landing page. I will highlight only one, the Kraków city. This is because the city is your host. So although we will travel all over Europe during the sessions, don't forget that we are in Kraków, Life Science Kraków. So I give the floor to Karolina Tkaczuk, and enjoy the session.
Thank you, Kazimierz. This is my very great pleasure to be leader for the first session entitled Digital Health. My name is Karolina Tkaczuk, and I'm a business developer manager for Sana Center for Computational Medicine. If you will have any questions after the conference or after this session about Sana, please contact me through the partnering system. And here I would like to welcome our first speaker, Professor Emmanuel Bubach, who's a Scientific Affairs Director and President of the Management Board of Sana Center. His background is in technical physics and computer science. He also leads a Laboratory of Information Methods in Medicine at ACC Ciphernet AGH Krakow. And is a professor of distributed systems engineering at the Informatics Institute, University of Amsterdam. His research interests include parallel and distributed computing and quantum computing. He served key roles in about 15 EU-funded projects and co-authored more than 230 papers. So here, without further ado, I would like to invite you, Marian, to give a keynote. Welcome.
Many thanks, Carolina. After there was a short discussion which language you used to present for presentation in this session, and it was decided that it will be in Polish because most of participants are from Poland. It will, most of its presentation and explanation about what is SANO I gave up to now were in English, so maybe I will try how it will be in Polish. No to ja spróbuję to powiedzieć po polsku w takim razie. Chciałem opowiedzieć o tym, jaka jest sytuacja z Centrum SANO po jednym roku funkcjonowania tego centrum. Wait a moment. Okay. So, na początku zawsze są jakieś problemy. Po pierwsze, warto powiedzieć, w jaki sposób jest finansowane SANO. Otóż w chwili obecnej SANO jest finansowane z dwóch źródeł. Mianowicie jest program badawczy, program naukowy SANO. Jest finansowany przez program, który się nazywa Międzynarodowe Agendy Badawcze, prowadzony przez Fundację na Rzecz Nauki Polskiej. A część wspierająca SANO, ta część, która dotyczy rozbudowy części administracyjnej i wsparcia ze strony IT, jest finansowana przez Europejski Program Teaming. Mamy nadzieję, że po roku 2023, kiedy skończy się finansowanie ze strony Fundacji na Rzecz Nauki Polskiej, do finansowania zgodnie z obietnicą włączy się Ministerstwo Nauki i niezależnie od tego, jak ono się będzie nazywało. Gdzie my jesteśmy w tym momencie? To jest ważne do powiedzenia. Ważne, żeby Państwo o tym wiedzieli. Mianowicie to nasze finansowanie jest finansowaniem, które będzie funkcjonowało przez około 7 lat, poczynając od sierpnia ubiegłego roku. I w tej chwili jesteśmy na końcu takiej fazy początkowej, która powinna się skończyć gdzieś w okolicy końca stycznia przyszłego roku, więc już całkiem niedługo. I jak Państwo widzą, w tym czasie powinny zostać zorganizowane wszystkie podstawowe agendy centrum i równolegle do tego w ograniczonym zakresie ze względu na sposób finansowania są prowadzone badania naukowe. A potem po prostu mamy czas, kiedy SANO będzie finansowane ze środków europejskich w głównej mierze, bo niezależnie od tego, czy są to środki, czy są to środki pochodzące z Fundacji na Rzecz Nauki Polskiej, czy środki pochodzące z Komisji Europejskiej, są w gruncie rzeczy pieniądze europejskie.
Excuse me, Marian, we cannot see your slide, so I'm not sure what happened.
You cannot see I have done nothing. Okay, so I will try to share these slides once again. Share. What about now?
It's working now, yes, thank you.
Yes, but what will be if I change the slide?
Let's check.
Wait a second. It's strange because I cannot. And now?
It's working, yes.
It's working. Okay. So we are now in the we are now in this formative phase. Jesteśmy teraz w tym etapie początkowym rozwoju SANO. I chciałem powiedzieć o tym, co się w tym czasie wydarzyło. SANO jest tym, co zostało utworzone przez inicjatywę dwóch instytucji, mianowicie grupy badawczej pracującej na AGH w Cyfronecie i w Katedrze Informatyki oraz University of Sheffield. To byli inicjatorzy tego pomysłu. Do tego dołączyli się koledzy z Klastra, z Centrum Komputerowego Willich i Fraunhofera. To jest rdzeń naszego centrum i wsparcia dla naszego centrum. Ale oprócz tego mamy po prostu to otoczenie, które funkcjonuje w Krakowie. Najważniejszą rzeczą to jest wsparcie ze strony i współpraca ze Szpitalem Uniwersyteckim i z Kolegium Medicum Uniwersytetu Jagiellońskiego. No i szereg różnych instytucji, które istnieją wokół naszego centrum. Dlaczego coś takiego jak Centrum SANO powstało? Dlatego, że wszystko to, co dzieje się we współczesnej medycynie, wskazuje na to, że ta medycyna będzie się przekształcała, zamieniając się z czegoś, co w dużej mierze można by zakwalifikować do swego rodzaju sztuki, do czegoś, co będzie techniką. Co będzie techniką wspieraną przez maszyny, przy czym te maszyny będą tutaj rozumiane jako programy komputerowe, ale cały czas ten czynnik ludzki w postaci lekarza, w postaci tego, kto podejmuje ostateczną decyzję na temat pacjenta, na temat sposobu leczenia, który będzie coraz bardziej zindywidualizowany, rola tego lekarza będzie wzmocniona poprzez to, że będzie dysponował bardzo silnym wsparciem w podejmowaniu decyzji. I kolejną przesłanką do podjęcia tego typu projektu, do tworzenia tego typu centrum jest sytuacja, z jaką mamy do czynienia w służbie zdrowia w Polsce, która, jak wiadomo, doskonale nie jest najlepsza i potrzebne są działania, które będą miały charakter niestandardowy. Wprowadzenie technologii cyfrowych jest czymś, co może być istotnym postępem w tej dziedzinie. I dlatego po prostu SANO. Stawiamy sobie takie 4 główne cele. Z jednej strony to jest rozwój, po to, żeby być skutecznym w tej dziedzinie, trzeba uprawiać naukę na możliwie najwyższym poziomie. W związku z czym podstawą i główną osią działalności Centrum SANO jest rozwój nauki w zakresie analizy danych, w zakresie tworzenia nowych, dostosowanych do potrzeb medycyny metod sztucznej inteligencji, rozwój modeli, algorytmów ukierunkowanych na to, żeby ta medycyna była coraz bardziej zorientowana na konkretnego pacjenta. I w wyniku tego powinny powstawać takie systemy wspierające podejmowanie decyzji. Powstaną po prostu nowe, oparte na metodach obliczeniowych, metody terapii, wspomagania tej terapii. Wokół Centrum SANO liczymy na to, że powstanie swego rodzaju zainteresowanie ze strony biznesowej. Kraków, a zwłaszcza Life Science Center, jest takim dobrym miejscem, gdzie to w dużej mierze już istnieje. Tyle tylko, że liczymy na to, że będzie ono zorganizowane w większym stopniu wokół naszego centrum. No i jest jeszcze jedna rzecz. Kraków jest znakomity w kształceniu zarówno w zakresie medycyny, jak i informatyki. Myślimy, że prace prowadzone w obrębie Centrum SANO przyczynią się również do tego, że to kształcenie w jednej i w drugiej dziedzinie staje się bardziej ukierunkowane na potrzeby medycyny, na potrzeby praktycznych zastosowań medycyny. To są nasze cele. Znaczną część tego roku, od kiedy Centrum SANO zaczęło funkcjonować, poświęciliśmy na dyskusję nad szczegółami naszego programu badawczego. I ten program badawczy został w zarysie przedstawiony w momencie, kiedy ubiegaliśmy się zarówno o grant WNP, jak i o grant Komisji Europejskiej, ale dyskusja, w szczególności dyskusja z kandydatem na dyrektora centrum, pozwoliła na sformułowanie takich 6 kierunków badawczych. Te 6 kierunków badawczych, które tutaj Państwo widzą, te 6 kierunków badawczych to będą również nazwy 6 zespołów badawczych, jakie będą funkcjonowały w naszym centrum w momencie, kiedy nowy dyrektor obejmie kierownictwo. Takim kluczowym kierunkiem i kluczową grupą, która będzie jak gdyby zbierała rezultaty wszystkich prac i nadawała im kierunek, będzie ta grupa, która nosi nazwę Health Informatics. Dyskusje, jakie prowadziliśmy, spowodowały, że doszliśmy do sytuacji, w której mamy równowagę pomiędzy badaniami związanymi z wykorzystaniem danych, z analizą danych, z wykorzystaniem metod inteligencji z jednej strony, a z drugiej strony z modelowaniem organów ludzkich i z wykorzystaniem symulacji. Wszystko wskazuje na to, że takie powiązanie tych dwóch sposobów podejścia będzie bardzo źródłem sukcesów. Przy wsparciu ze strony nowoczesnych metod obliczeniowych. Nasze cele są takie, żeby od możliwie najlepszej nauki, publikowanej jak najlepiej, nauki tworzonej przez możliwie najlepsze kadry naszego centrum, poprzez interakcje z różnymi instytucjami o charakterze biznesowym, doprowadzić do tego, żeby centrum było źródłem takich produktów, które będą mogły znaleźć swoje zastosowanie w szpitalach i które po tym okresie, kiedy centrum będzie finansowane przez te projekty, mogło zagwarantować stabilność funkcjonowania tego centrum. Nasza idea jest taka, żeby w pewien sposób postępować podobnie jak to jest z instytucjami Fraunhofera w Niemczech, mianowicie żeby mieć 1/3 finansowania zagwarantowaną ze źródeł typu badania statutowe, 1/3 ze współpracy z otoczeniem biznesowym i 1/3 z grantów krajowych i europejskich. Centrum SANO jest autonomiczną jednostką naukową. Jednostką naukową, która funkcjonuje w oparciu o prawo o fundacjach. Prawo o fundacjach ma tę przewagę, że od 1984 roku niewiele się tam w nim zmieniło i ustawa dotycząca fundacji liczy sobie chyba zaledwie 6 stron w porównaniu z opasłymi tomiskami innych regulacji prawnych. Więc aktem notarialnym zostało powołane to centrum 17 lipca ubiegłego roku. Od 5 sierpnia jest zarejestrowane w KRS. Od 1 października realizuje grant MAP Międzynarodowego Agent Badawczych WNP, a od 1 sierpnia, kawałek wcześniej, jest częścią projektu, uczestniczy w realizacji projektu Teaming, a następnie po prostu od stycznia tego roku 2020 jest partnerem projektu Teaming. Skoro to jest fundacja, to fundacja posiada swoją radę, która jest tym organem decydującym o głównych kierunkach, i zarząd, póki co jednoosobowy, ale wkrótce ten zarząd zostanie rozbudowany. Istotną rolę odgrywa Międzynarodowy Komitet Naukowy, bo ten komitet naukowy decyduje o tym, kto będzie dyrektorem centrum, decyduje o tym, kto będzie kierownikiem poszczególnych, jednej z tych 6 grup badawczych, prowadząc międzynarodowe konkursy na ten temat. Skład, jak widać, jest międzynarodowy. Każdy z partnerów delegował członków do tego komitetu i komitet wykonał już pierwszy etap pracy, mianowicie przeprowadził konkurs na dyrektora centrum. Ten konkurs mamy za sobą i liczymy na to, że od 1 stycznia przyszłego roku, czyli całkiem niedługo, nowy dyrektor obejmie swoją funkcję. Centrum zatrudnia w tej chwili 12 osób. Te 12 osób jest finansowanych zarówno z części badawczej, jak i z części wspierającej badania. Przy czym, proszę Państwa, to jest prace, jakie tutaj zostały wykonane, to są prace związane z tworzeniem po prostu nowej jednostki naukowej. Nowej jednostki naukowej, która musi posiadać wsparcie o różnym charakterze i udało nam się znaleźć osoby, które są znakomite w tym, co robią. Dzięki temu to centrum po prostu już zaczęło sensownie funkcjonować. Mamy zawarte porozumienie z Akademią Górniczo-Hutniczą. Mamy wsparcie ze strony rektora AGH, porozumienie z Kolegium Medicum Uniwersytetu Jagiellońskiego i ze Szpitalem Uniwersyteckim jest w ostatniej fazie dyskusji. Centrum jest zlokalizowane w tej części badawczej w budynkach Centrum Energetyki AGH. Oprócz tych osób, które były wymienione na poprzednim slajdzie, mamy około 20 osób, które funkcjonują w ramach projektu Teaming u naszych partnerów. To jest bardzo istotne, dlatego że poprzez to między innymi kontynuujemy naszą współpracę z Uniwersytetem Sheffield, z Centrum Komputerowym Willich i mamy wsparcie Fraunhofera i Klaster Life Science. NCBR jest bardzo istotnym elementem w naszej początkowej fazie. Istotną rolę w budowaniu, w tworzeniu rozwiązań o charakterze naukowym będzie przypadała doktorantom. Ci doktoranci będą doktorantami realizującymi program naukowy centrum, natomiast będą oni realizowali te swoje doktoraty, zdobywali tytuły doktorskie w tych instytucjach, które Państwo mają tutaj wymienione, w zależności od tego, jaki to będzie typ działalności. I chciałbym pokazać taki slajd, który być może wygląda na przeładowany nieco, ale on jest o tyle znakomity, bo ilustruje doskonale, do czego my zmierzamy. Zamierzamy mieć zatrudnionych w centrum około 70 osób. I spośród tych 70 osób zdecydowana większość będzie pracowała w zakresie badań, ale kwalifikacje pozostałej kadry będą kwalifikacjami najwyższego poziomu, wspierających badania. To będzie bardzo często sytuacja, w której będzie przekrywanie się kompetencji.
Marian, we're running out of time, unfortunately, so maybe we could take one question we're on a very tight schedule, so unfortunately I'll have to stop you like in a minute.
Maybe I will show just something which is a kind of I would like to invite you as a part of our, let's say, scientific program to seminars which are at all Mondays at 2:00 afternoon. So you are invited to join us, and here you have a list of topics which were presented up to now.
Thank you very much, Marianne, for this very nice overview of Sano Center. We have time for literally one question. So if anyone would like to ask a question, please do so now. And in the meantime, I would like to ask our IT support to share the slide that will be presented by Tanya. Are there any questions? So Marianne, if you could stop sharing the screen so
Okay.
IT could, Joanna could actually display Tanya's slide. I would appreciate that.
Mm-hmm.
Thank you. Okay.
Thank you.
Thank you very much again, Marianne. And if there are no further questions, I would like to invite Dr. Tanya Bratan from our partnering institution, Fraunhofer, who will tell you a few words about the survey that they're doing for Sano. Tanya, the floor is yours.
Thank you, Carolina. Can you hear me okay?
Yes, we can. Thank you.
Perfect. So thanks for the opportunity to present here. I'd like to introduce a piece of work to you that we're doing at Fraunhofer ISI. And I'd like to ask you to participate. It's a survey of the needs and perspectives and the challenges that people from clinical practice and research and industry have and face with regards to computational medicine. And for Sano, it's a major priority to address real healthcare needs and to deliver products and services that the partners and customers need. And that's why we're doing the survey. And so I'd like to encourage you to share your views with us so that we can incorporate them into the strategic priorities of Sano. And it's really an opportunity to kind of shape what Sano does. So we're keen to hear from all kinds of people, not just experts in computational medicine. I'd like to emphasize that. And the survey only takes about 10 minutes to complete and is anonymous. And I've copied the link into the chat. So if you'd like to start filling it in, you can do that. And also please feel free to share it with your colleagues and other people who might be interested, because we're really looking for as much input as possible. This is the link I've copied there is the link to the Polish version. There is also an English version. If you'd like the link to that, please let us know and get in touch. Yes, I'm looking forward to your input, and I would like to thank you.
Thank you very much, Tanya. We appreciate it. And of course, with Tanya, we encourage you to fill out the survey. And here I would like to invite our next speaker, who is Klaudia Szklarczyk-Smolana, who is a medical doctor and co-founder of the company called Intellisec that was founded in 2014. And it's a company that provides flexible and agile bioinformatics solution for genome interpretation. So Klaudia, the floor is yours.
Carolina, thank you very much. I hope that you can see my presentation right now.
Yes, it's visible. Mm-hmm.
Okay, perfect. I will just minimize the audience. Okay, now it should be visible. So hello, everyone. Once again, I'm Klaudia, and I'm a co-founder of Intellisec, which is a genome informatics company where our mission and let's say also passion is to accelerate the genome-based medicine by providing fast and straightforward genome data analysis. I would like to talk with you a little bit about our company and the opportunities of collaboration. So the fact is that genomic data impacts all phases of healthcare, whether we're talking about faster diagnosis, safer treatment, or even cost-effective health prevention. And the cost of human genome sequencing nowadays is roughly $1,000, and it can be done in one day. So the decreasing cost of sequencing and the importance of genomic data has led to the fact that more and more patient genomes are being sequenced. Each genome takes around 200 gigabytes. And if you multiply that by 20 million genomes predicted to be sequenced by the end of 2020, you'll see the problem. An overload of raw DNA data that needs to be sequenced. And how does the situation look in laboratories nowadays? The process of analysis and interpretation are the longest, the most expensive, and the labor-intensive ones in the whole process genome data workflow in the laboratory. It's because there are still few experts in the field, especially in the field of analysis. There are still some proper IT tools lacking, and there are problems with translating, transferring scientific knowledge into clinical practice. To answer these problems, we're developing a simple software as a service platform for genome data analysis and interpretation, and it's called IntelliSec Flow. So where are we in the whole process? IntelliSec Flow can be treated as a simple plugin for already existing laboratory information management systems. So the systems that are established in laboratories, the software systems that are established in the laboratories, for example, maintaining the samples. And if the lab would like to access the genome-based medicine field, or is already there but would like to accelerate their activities in the field, the lab can use our software that automates the whole process of analysis and interpretation, and in the end generates the reports with clinical insights in different fields of precision medicine, including disease prediction, diagnosis of genetic diseases, pharmacogenomics, and consumer genetics. And I will like to talk about those fields in a second. So in few words, IntelliSec Flow can be called all-in-one solution for genome data analysis. It's a comprehensive platform that takes raw sequence, raw DNA data in FASTQ files, and generates clinically relevant reports based on those raw files. And apart from the engine that we're developing, the bioinformatic engine, there's also an interface that we're doing our best to be as user-friendly as possible, so that the IntelliSec Flow in the end would be a bioinformatician-less platform. So you don't need any bioinformatics to use the platform. All the laboratory technicians or people that are taking care of genomic data can run the analysis on the platform. Last year we implemented the ISO for medical devices, and we're using Google Cloud, which is compliant with HIPAA. So we're fulfilling all the regulatory and security requirements. A few words about the market. The NGS market can be almost half and half split into NGS services and NGS other, which includes sequencing platforms and consumables. And we are in the field of NGS services, so the data management services, data analysis services, and sequencing services also. And this branch of market, NGS services, is projected to reach over 24 billions of US dollars by 2025, with annual growth set at around 20%. And as for the market buyers, hospitals that comprises of only around 5% of all laboratories in the US, performed the largest test volume. It's more than 50%. And on the second place, we've got independent laboratories. They comprises of around 3% of the market, but they perform around 30% of genetic tests. There are other competitive softwares being offered for such laboratories, for molecular diagnostic laboratories. And we can divide our competitors into two fields. One can be called easily accessible software as a service platforms. And the other one would include complex clinical platforms as the ones offered by Pharmacogenomics or Sophia. And we would like to offer a solution that is something in between, that takes the best from those two groups and offer it as a one solution. So what sets us apart from our competition is on one hand, the comprehensive analysis in different fields of interest. So we offer not only solutions dedicated for research, but also analysis in the field of health or wellness. And apart from those complex, huge platforms, in contrary to them, we don't have any upfront costs. So the user will only pay per analysis. So the costs are visible from the very beginning. And we've got many advanced workflows for data analysis. So it's not only preliminary analysis as it is in those SaaS accessible platforms, like, for example, in BasePair, where you have only, you can only conduct analysis to a set time point, and then you have to use your own bioinformaticians to continue the analysis, the process of analysis. So our platform is bioinformatician-less and provides the full clinical report in different areas of precision medicine. So to run analysis, you just need three basic steps. You need to create an account. It's available, the platform is available on a website, so everyone can log in. Then you just need to upload your samples. You can upload the samples from your own computer or from any cloud. And then you just select the workflows that you are interested in and run the analysis. And here's a screen from the results page of one of the analyses being conducted in the platform. So apart from there are as an outputs, or let's say results, there are many files included. And apart from the report with final results, you've got also many technical files. So if any scientists, researchers, and bioinformaticians or geneticists in the laboratory would be interested in more technical scientific files, there are also there. The files related, for example, with quality control, so on and so forth. And thanks to the latest technologies being used in our platform, for example, thanks to using WDL, so Workflows Development Language, and Cromwell engine, we're enables our users to reproduce the analysis everywhere, and the analysis can be done parallelly. And thanks to Google Cloud, they can be also scalable. And thanks to biocompute objects, the quality is assured. So the heart of our platform are workflows, as I said previously. So these are actually set of tools and pipelines dedicated for genome analysis in different fields. You've got here on the screen an example list of workflows that you can select from on our platform. Here are a few examples of particular workflows, particular areas of analysis that can be done on our platform. The first one can be called genetic diseases. The user can choose from panels grouped in 22 areas. One of them is incidental findings, but you can also choose panels related to particular diseases, like, for example, cardiovascular disorders. The next big group of tools for analysis is called pharmacogenomics. So you can search for genetic variation in genes related to drug metabolism. We implemented here the requirements from a clinical pharmacogenetics implementation consortium. So we've got genetic variation and response to 28 drugs recommended by CPIC. Another field of analysis that can be run on our platform is called polygenic risk scores. And these are computational models prepared by our team that can support the process of analyzing the genetic predispositions to different polygenic traits, not only health-related traits, but also traits related to so-called wellness field, for example, the example traits from the nutrition field. So the scores are based on huge GWAS studies. Basically, there are just some of SNPs related with a specific polygenic trait, and the SNPs are weighted with their importance differ according to their significance in a particular GWAS that was used for preparation of this specific computational model. A few words about IntelliSec. The company was established by scientists, experts in the field of bioinformatics, software development, of course, genetics, and moreover, mathematics and statistics. Nowadays, the team comprises also of the group of experts in business and administration. And we've got, we're based in Kraków, but we've got a US-based entity. And we were recognized lately in the contest, the challenge organized by Precision FDA that awarded us for our documentation and usability according to the reports generated on our platform. We also got to the finals of MIT Enterprise Forum for the whole Central and Eastern Europe region. And we also were acknowledged by Boston Children's Hospital by getting to the finals of Clarity contest, which was a contest dedicated for finding the diagnosis for 5 cases of patients from the Boston Children's Hospital. So we're very interested also in international competitions. The company was set in 2014 when we received first funding from Małopolska Regional Development Institution. And then after one year, we've received our first research project from the National Center for Research and Development, and it was called GeneTraps. It was dedicated for bioinformatic tools for rare diseases, and we finished this project lately with success, so it's already ended up. And right now we're focusing on 2 others R&D projects also financed by the National Center for Research and Development. One is focused on pharmacogenomics, and the other one is focused for developing computational models based on polygenic risk scores. So this one is more dedicated for consumer genetics field. As for the IntelliSec Flow platform that works as a merge for all the bioinformatical tools that we have developed, we started the first task of the IntelliSec Flow back in 2019. And during the last year, we are adding another workflows to the platform, and we're also testing it for usability and functionality. So right now, currently we're in a beta testing phase. So we're also looking for laboratories and research centers interested in conducting a pilot implementation together. During our existence, we have established many partnerships around Europe as well as in USA. We were able to integrate our platform with the whole laboratory information systems in one of the biggest companies called SCC that provides such LIMS, so laboratory information management systems, all over the world in laboratories. In Poland, we've did a few implementations, including Collegium Medicum and Mosakowskie Medical Research Center in Warsaw. And we've got also partners in US in the field of consumer genetics. And as for the pharmacogenomics, we were able to do a pilot implementation with Adamat in Poland. And most of these partnerships and cooperations end up with scientific papers that we co-authorships. And we serve there as a support, bioinformatical support in the field of genome analysis, as well as interpretation of genomic findings. So we're very open for any kind of cooperation, not only as a bioinformatics support in, let's say, translational solutions for research centers and wider in the biotechnological area, but we are also open for joint R&D projects. And as I mentioned, because of the interdisciplinary team, we are also open for sharing our expertise in the process of educating others, for example, PhD students. And as I mentioned also, we are also, because of the beta testing of our platform, we're also very open for all the laboratories and research centers interested in support in genome data analysis to test our solution, because it's available right now. So that's all that I would like to show you. Thank you very much, and I would be happy to answer some of the questions.
Thank you very much, Claudia, for this very interesting presentation and invitation for collaboration. As I understand, the beta testing is free of charge. So
exactly.
Yeah.
Yes.
So if there's anybody interested in running their free samples, well, their samples on IntelliSec platform, please contact Claudia after the session or via B2B system. And talk to her. She'll be more than happy to answer the questions, I presume. In the meantime, is there any question for Claudia right now? I don't see any. So thank you very much, Claudia, again for your presentation.
Thank you very much.
And I would like to invite our next speaker, who's Dr. Artur Kovalick, the head of the Department of Molecular Diagnostics at the Holy Cross Cancer Center, whose research focuses on molecular biology and cancer and development of novel markers for cancer diagnostics and management. So as you can see, there's a direct connection between the two topics. So we saw the computational perspective, and now we'll see more of a clinical take on that, on the genetic testing. So Artur, the floor is yours. Thank you very much.
Thank you, organizers, for invitation. And I'd like to switch to in Polish because most of the audience is in Polish language speaking. So can you see my presentation or no?
Not yet.
Not yet.
Wait a second.
Yes, we can see it now.
And now? Can you see it now?
Yes.
It's perfect.
Yes, we can see it very well.
Okay, so Chciałem przedstawić nasze przemyślenia moje na temat takiej perspektywy big data, medycyny, digital medicine z perspektywy laboratorium. Ja pracuję w Świętokrzyskim Centrum Onkologii i to jest kompleksowy szpital leczący w sposób kompleksowy pacjentów, więc my mamy około 40 poradni różnych, w których codziennie przyjmujemy około 1500 osób. Może w tej chwili jest ich troszeczkę mniej ze względu na epidemię, około ponad 20 działów klinicznych i kilkanaście działów diagnostycznych. No i oczywiście medycyna personalizowana w Świętokrzyskim Centrum Onkologii zadomowiła się, jest leczenie w sposób personalizowany, jest prowadzone od ponad 15 lat, tak naprawdę wraz z wprowadzeniem pierwszych leków takich, które były finansowane, które są finansowane przez Ministerstwo Zdrowia. Po pierwszym była Herceptyna w 2003, później inhibitory EGFR w raku płuca. I oczywiście, żeby realizować medycynę personalizowaną, potrzebna jako baza jest odpowiednie finansowanie oraz współpraca specjalności różnych dziedzin, począwszy od onkologa klinicznego, który inicjuje to całą diagnostykę i cały proces poprzez patologa, biologa molekularnego, no i oczywiście dostęp do odpowiednich leków. Zakład, którym kieruję, został założony w 2008 roku. W 2010 roku praktycznie zakupiliśmy, bo zastanawialiśmy się wtedy, co kupić. Czy kupić maszynę dużą, która jest w stanie sekwencjonować całe genomy, czy kupić coś, co sekwencjonuje panele genowe, mniejszą liczbę genów. Wybraliśmy to drugie rozwiązanie, czyli kupiliśmy PGM-a, jednego z pierwszego w tej części w ogóle Europy. No i 3 lata później zaczęliśmy jako pierwsi, na przekór wszystkim obiegowym opiniom w Polsce o homogenności i przewadze założycielskich mutacji, zaczęliśmy sekwencjonowanie całych genów BRCA1, BRCA2 dla pacjentów leczonych z powodu raka piersi czy raka jajnika. Później rozszerzyliśmy to na badanie z tkanki i trzeba przyznać, że ideą tego zakładu i wszystkich technologii, jakie mamy w posiadaniu, jest wprowadzanie ich bezpośrednio na użytek dla pacjenta. To jest idea, którą się kierujemy, bo głównym celem SCO jest leczenie tych pacjentów, więc staramy się jak najszybciej przybliżać jak najnowsze technologie dla naszych pacjentów. Oczywiście dalej rozszerzaliśmy naszą bazę, w kolejnych latach kupiliśmy kolejne sekwenatory, które były szybsze w użyciu i dawały lepszej dokładności dane i ostatnio, dosłownie kilka miesięcy temu, nabyliśmy jako siódmi chyba w Europie G-Nexusa. To jest też sekwenator, który pozwala sekwencjonować panele genowe w sposób ekstremalnie szybki, ponieważ po 14 godzinach od włożenia DNA czy RNA mamy wynik. I tak jak mówię, kierujemy się tutaj jak gdyby dobrem pacjenta i uzyskaniem przez niego jak najszybciej, największej liczby danych, która jest użyteczna klinicznie do leczenia, które jest dostępne w naszym kraju. I oczywiście prowadzimy też różne intensywne kooperacje z firmami farmaceutycznymi. W tej chwili mamy kilka projektów, które wykonujemy z nimi we współpracy i współpracujemy również z firmami, które zajmują się analizą big data. To są głównie takie projekty naukowe, na które staramy się znaleźć finansowanie. Oczywiście zakład, którym kieruję, wykonuje około 10 000 różnych testów rocznie i oczywiście to nie jest nie tylko NGS, ale różne testy, począwszy od zwykłych testów jednogenowych, skończywszy na panelach genowych kilkudziesięciu genów. I oczywiście wykonujemy badania, które są potrzebne dla pacjentów, czyli 3 bloki takie możemy wyróżnić jak geny, które predysponują do chorób nowotworowych rozwoju, jak na przykład BRCA1, BRCA2, czy stratyfikacja pacjentów do terapii celowanych w przypadku nowotworów litych, jak na przykład czerniak, rak jelita grubego, rak płuca, czy diagnostyka i leczenie i monitorowanie skuteczności tego leczenia w nowotworach onkohematologicznych, takich jak przewlekła białaczka szpikowa, czy ostra białaczka mieloidalna. Co do medycyny precyzyjnej, w naszym kraju, że leczenie lekami celowanymi odbywa się w ramach tak zwanych programów terapeutycznych. Są to programy, które są ściśle dedykowane dla danego typu nowotworów i są tam zawarte dane leki. Poza tymi programami leczenie pacjentów jest prowadzone w wyjątkowych sytuacjach. Jest to też obwarowane różnymi dokumentami, które trzeba wypełnić. Pytanie jest takie, czy my potrzebujemy sekwencjonowania całogenomowego czy całoegzomowego w diagnostyce? Ja nie mówię tutaj o badaniach naukowych, bo to jest pytanie bezsprzeczne. Pytam się tutaj, to jest takie pytanie, które postawiłem sobie i uczestnikom tej konferencji, czy my potrzebujemy tego? Ja je pozostawię bez odpowiedzi. Mam nadzieję, że z czasem ta odpowiedź sama się wyklaruje. Jakie są problemy w naszym kraju? To, co ja obserwuję, czyli nie ma takiego pełnego, szerszego dostępu do nowych leków, aczkolwiek sytuacja jest lepsza niż to, co było kilkanaście lat temu, bez wątpienia, ale na pewno nie ma takiego szerszego dostępu. Nie jest możliwe lub bardzo utrudnione, żeby leczyć pacjenta poza programem lekowym, nawet jeśli się znajdzie tak zwaną mutację do leczenia, czyli po angielsku piękny zwrot druggable mutation. Więc to jest utrudnione dość. Nie ma też finansowania, żeby sekwencjonować guzy nowotworowe czy próbki pochodzące z nowotworów, jeśli chodzi o sekwencjonowanie całogenomowe czy całoegzomowe. Ja tutaj mówię o komplecie, oprócz sekwencjonowania, całą różną otoczkę, bo samo sekwencjonowanie to już nie jest rocket science, jeśli chodzi o sekwencjonowanie NGS. Oczywiście to, co przedstawiał prelegent tuż w poprzedniej prezentacji, oczywiście cała anotacja tej informacji i przedstawienie w sposób użyteczny dla klinicysty, to jest w tej chwili to, na czym skupia się cały świat. No i czwarty problem, jaki ja obserwuję, że nie ma tak zwanego narodowego takiego systemu rekordu elektronicznego pacjenta, który byłby w stanie, który towarzyszy pacjentowi, czy osobie ze społeczeństwa, której towarzyszy ten rekord począwszy od urodzenia. Nie ma czegoś takiego. To jest taki prosty przykład. Jeżeli ulegniemy jakiemuś wypadkowi, na przykład drogowemu, i mając taki system, zlokalizując taką osobę, która uległa wypadkowi, lekarz w pogotowiu, czy ratownik medyczny, który się zajmuje takim pacjentem, mógł od razu spojrzeć w historię takiego pacjenta, zobaczyć, na co on chorował, na co nie chorował, na co jest uczulony. Niestety nie mamy takiego systemu globalnie, który mógłby takie dane globalnie w sposób narodowy zbierać takie dane, no i że tak powiem, gromadzić w czasie rzeczywistym. Tak? Jak chodzimy do lekarza, to konto nasze jest cały czas otwarte i cały czas gromadzi te nasze dane, oczywiście z jakąś możliwością uzupełniania tych danych przez samego użytkownika. No i oczywiście przez to, że nie mamy takiego systemu, mówię, narodowego systemu, bo oczywiście istnieją różne bazy danych poszczególnych ośrodków, ale no nie mamy takiego systemu, który by obejmował cały nasz kraj, to w takim przypadku, że my nie mamy takiego systemu, to my niestety tracimy te dane, zamiast z nich korzystać. No i oczywiście rozwiązanie problemów 1, 2 i 3 spowoduje, że w tym kraju będzie realizowana medycyna precyzyjna w pełnym stopniu, tak? Czyli cofnąć się dostęp szerszy, możliwy dostęp do terapii celowanych, leczenie tak zwane off-label, czyli w przypadku też wykrycia druggable mutation poza programami lekowymi i oczywiście finansowanie o odpowiednim poziomie sekwencjonowania całogenomowego czy całoegzomowego. To może tak naprawdę otworzyć w pełni, w 100% medycynę personalizowaną w naszym kraju. Oczywiście ona jest realizowana już, tak jak powiedziałem, od ponad 15 lat w naszym kraju i oczywiście z podobnymi problemami też borykają się inne kraje, w tym kraje Europy Zachodniej niektóre. Jest to jednak warunek, który trzeba spełnić, żeby myśląc o precyzyjnym leczeniu i terapii celowanej, ja tutaj się skupiam oczywiście na chorobach nowotworowych, ale analogiczne problemy też są w innych chorobach. No i oczywiście rozwiązanie czwartego problemu, czyli posiadanie narodowego systemu, zintegrowanego systemu, który gromadziłby takie dane medyczne, począwszy od urodzenia obywatela i towarzyszyłby mu przez całe jego życie. Proszę sobie też wyobrazić taką dygresję, jeżeli każda osoba jeżeli to oczywiście będzie etycznie możliwe, będzie mogła mieć sekwencjonowany genom, taki genom, można powiedzieć, referencyjny dla tej osoby, to ten genom będzie mu przydatny przez całe życie. Raz, że może być to referencją, która będzie stosowana do analizy, jeżeli rozwinie chorobę nowotworową w przyszłości, a dwa, że tak naprawdę przewidywanie, to co prelegentka mówiła w poprzednim wykładzie na temat przewidywania różnych ryzyk i tak dalej. No i oczywiście gromadzenie tych danych w sposób narodowy pozwoli na wykreowanie takiej bazy, która będzie służyła za taką podstawę do generowania nowych hipotez, realizowania racjonalizacji wydatków na potężnych kosztów związanych z leczeniem, a z drugiej strony na pewno przyniosłaby niesamowite oszczędności finansowe, ponieważ to by pokazywał obraz cały, gdzie trzeba dofinansować który sektor, a który nie potrzebuje i gdzie można uniknąć takich wydatków. I oczywiście, wracając do pytania, prowadzenie analiz całogenomowych czy całoegzomowych, wielkoskalowych generalnie wiąże się ze zdobywaniem nowej wiedzy, a ta nowa wiedza przekłada się między innymi na stratyfikację do leczenia, na przewidywanie ryzyka, czyli unikania lub łagodzenia skutków rozwoju choroby. Zwiąże się z odpowiedzią na leczenie, czyli racjonalizacją ogromnych wydatków na leczenie, bo trzeba pamiętać o tym, że skok technologiczny w medycynie generuje kwadratowe koszty. Jeśli chodzi o koszt i wydatki na leczenie obywateli. I oczywiście kreowanie nowych hipotez, wykrywanie nowych celów dla terapii, to bez wątpienia przynoszą analizy wielkoskalowe, w tym sekwencjonowanie całogenomowe. Proszę sobie wyobrazić, że gdybyśmy posiadali narodowy system, narodową bazę danych, która kolekcjonuje dane medyczne pacjenta, włącznie w połączeniu z uczestnictwem tych pacjentów w różnych wielkoskalowych badaniach, tudzież w uczestnictwie w diagnostyce realizowanej w sposób wielkoskalowy, te dane niejako gromadzą się same i to wtedy spozycjonowałoby nasz kraj w całkiem innej grupie i mogłoby mieć szalony wpływ na rozwój gospodarczy, a szczególnie sektora biotechnologicznego. Oczywiście to wszystko wymaga zmiany myślenia i tego podejścia, coś bardzo zauważył w swojej książce Eric Topol, szczególnie w Stanach Zjednoczonych, gdzie ta opieka jest uważana za jedną z najlepszych. Oni też zauważyli to, że lekarze czy ludzie pracujący w ośrodkach medycznych są przytłaczani górą papierów, także nie ma czasu na rozmowę z pacjentem. Między innymi tak też się dzieje i w naszym kraju, więc on tu upatruje rozwiązań technologicznych związanych ze sztuczną inteligencją, która niektóre procesy będzie automatyzowała, między innymi choćby to gromadzenie danych, o którym mówię od samego początku. Oczywiście rozwój technologii nowoczesnych, które umożliwiają wytworzenie nowej jakości. Jak bez rozwoju komputerów nie byłoby bioinformatyki, a bez bioinformatyki nie byłaby możliwa analiza wielkoskalowa, o której wspominała prelegentka. I oczywiście trzeba marzyć wielkoskalowo, podkreślam. To jest takie zdjęcie ciekawe. Elon Musk 18 lat temu, jak na komputerze wizualizował swoje rakiety, no i oczywiście 18 lat później te rakiety latają do góry, nie dość, że latają, to jeszcze wracają bezpiecznie na dół. To jest sprawa, o której trzeba pamiętać, więc myśleć szeroko, jasno i nie bać się tego myślenia i oczywiście ze wsparciem i z rozwiązaniami na poziomie narodowym, uważam, to wtedy takie wprowadzenie nowej technologii będzie miało największy skutek i otworzy tak naprawdę medycynę personalizowaną w naszym kraju, te drzwi otworzy najszerzej. I oczywiście jednym z takich nowych rozwiązań jest quantum computing, które tak naprawdę stawia możliwości obliczeniowe komputerów w innym świetle, a tym samym na pewno bez wątpienia będzie miało wpływ na tworzenie nowych leków, na przewidywanie skuteczności tych leków i z drugiej strony na prowadzenie badań klinicznych oraz na szybkość wprowadzania nowych leków. I oczywiście Z drugiej strony też trzeba będzie być gotowym diagnostycznie, żeby móc stratyfikować pacjentów do nowoczesnych terapii. Takim wyzwaniem są nowotwory i najnowsze prognozy na jeszcze zakończenie. Powinien być optymistycznie, że w 2030 roku uważa się, że na globie ziemskim co drugi mężczyzna i co trzecia kobieta w trakcie swojego życia rozwinie chorobę nowotworową, więc na pewno będzie to ogromne obciążenie dla systemów podatkowych społeczeństw, więc oczywiście jak najbardziej big data tak i wydaje mi się, że nie możemy w kraju naszym tracić więcej czasu na zastanowienie się nad gromadzeniem tych danych i przede wszystkim nie mamy już czasu nad traceniem tych danych. Dziękuję bardzo Państwu za uwagę. Thank you for your attention.
Thank you very much, Arthur, for this very inspiring, comprehensive analysis and presentation. I think there wouldn't be any digital health without the clinics, of course, and the take from the clinics is extremely important to understand how institutions working with computational methods can actually assist real world and resolve actual problems. So thanks again for this presentation. Are there any questions for Arthur for right now?
Tak, jeżeli można zadać
Bardzo
pytanie?
proszę.
Ja mam dwa. Chciałam skorzystać z Pana, tak powiem, zorientowania w tym temacie, a mianowicie, czy Pan zna miejsce i placówki na terenie Polski, które rzeczywiście sekwencjonują kompletne ludzkie genomy?
Jeśli chodzi o, mówimy tu o diagnostyce, tak?
No, diagnostyce w ogóle. Czy jest laboratorium, które jest w stanie taką
Jest kilka firm, które nie wiem, czy samodzielnie sekwencjonują, chyba, które są w stanie samodzielnie sekwencjonować genomy i podejmują się ich analiz. Ja tylko chciałem jedną rzecz powiedzieć, nie wiem, czy to wybrzmiało z mojej prezentacji, że jest jest kilka firm, które są w stanie zrobić whole exome sequencing, whole genome sequencing, tylko tak jak mówię, wszystko się opiera na tym, jak te dane posłużą pacjentowi. I bez, tak jak mówię, dostępu do leków, bez zmiany polityki.
Nie. Znaczy, wie Pan, bo mnie chodzi po prostu o to, czy jest laboratorium, które jest w stanie zrealizować zadanie, gdybym przyniosła, powiedzmy, genom jakiś ludzki, czy jest możliwość fizyczna wykonania jego sekwencji?
Tak, jest. Są w Polsce takie laboratoria.
Są,
znaczy,
tak?
my się nie zajmujemy whole genome, my jako SCO, ponieważ
Tak.
z tego tytułu, że zajmuje się...
Ale nie jest Pan w stanie mi powiedzieć w tej chwili na przykład, gdzie to jest? Warszawa czy jakiś...
Nie, to jest, o ile się nie mylę, to są firmy w Warszawie, jest firma też w Białymstoku, są firmy w Krakowie, tak naprawdę.
Dobrze, a proszę Pana, jeszcze drugie mam pytanie. Panele genowe, to co to jest?
Panele genowe właśnie, nie wyjaśniłem tego, to jest sekwencjonowanie kilku do kilkunastu genów, tak?
Aha.
I te panele to są po prostu zwykle nakierowane, żeby wykrywać, czy diagnozować jakąś jednostkę, czy podatność na jakieś leczenie jakiejś choroby.
Dobrze, dziękuję bardzo.
Are there any more questions? Okay, if there are no more questions, thank you very much for this very inspiring presentation and for being with us today and answering our questions. And here I would like to ask our next presenter, Professor Irena Roterman-Konieczna from the Jagiellonian University Medical College Bioinformatics and Telemedicine Department. She specializes in bioinformatics involved in protein structure analysis and protein folding simulations. And here also I would like to congratulate her to be recognized by Elsevier and Stanford University as a top 2% most influential scientist in the world. And she's been recognized as one of the most influential scientists just recently, and chosen from more than 160,000 scientists from all over the world. So the floor is yours, and we will hear about the construction of proteome.
Okay. Ja. and the full screen. Aha, and I am confused. Shall I use the English language or Polish language? Or what
Whichever you prefer. We have a simultaneous interpretation, so you can use either one language.
Okay, so I will try to use my poor English language.
Thank
So my presentation will be completely different to the former ones due to the very, very basic character. So this is absolutely basic research. We are living now in a so-called OM era. It means that every specialization wants to collect all data from the field of research. So this is like genome, the complete sequencing, and proteome. This is like a construction of the world created by proteins in every living organism. This is a subject which is actually the main point of the new discipline of science, which is called systems biology. I will present here the commonly used approach, very frequently represented in literature, and I will try to present also our own model we developed here in Kraków. I am representing Jagiellonian University Medical College. So genomics are already satisfied because they have access to any complete genome of any organism, and people involved in protein biochemistry, they are dreaming about proteome. It means all proteins in one place, and of course the recognition of the mechanism, sort of algorithm to answer the question how actually it works. How do we distinguish a living organism and something what is not alive? According to the genome analysis, there were about 30,000 proteins identified in the human body. And now the question is, how are they organized all together? 30,000 elements, and the question is how it works. So the first, at the very beginning of this research, the proteome was constructed like on this picture. It means that every dot on this picture is representing one particular protein. And as you may guess, the line connecting two dots means that these two proteins are interacting. The main idea was that the longer is the line connecting two proteins, the shorter is the interaction between them. As you may see, the dots are colored, and according to the information here on the bottom, we can recognize that the color is informing us what is the biological activity of this protein. And to make a step toward our model, I must say that here is a conflict between the very detailed unit, the structural unit, which is one single protein, and the function is described on a cellular level. It means the function is already given as a very, very complex system. So we try to build a construction using a very elementary unit, but the question we want to answer is extremely complex. This philosophy of the protein construction was used to recognize the proteome of yeast. So on the left side, we have a real proteome using, of course, the philosophy I presented on the former slide, which shows all the connections. Here are 1,500 proteins and almost 2,000 connections. And this proteome on the left side was constructed basing on a experimental, very developed and very advanced analysis, laboratory analysis. Here, the color distinguishing is related to the importance of the protein. So every red dot on the left picture represents so-called lethal protein. It means that if one of these red dots, these red proteins is misfunctioning, the yeast doesn't survive. So when we take a look on this picture, we must realize that it represents a very, very advanced, very modern technique, the biotechnology technique, because somebody was obliged to grow yeast with so-called knocked out genes to check whether a particular protein is lethal or not. So very advanced research, but if we ask the question, do we know anything more about yeast, particularly if we take it as an example of the living organism? Imagine on the right side that we cancer this one red dot. So probably when we take a look and compare these two proteomes, we probably even were not able to recognize a difference between these two proteomes, and the right one without this very little red dot represents that. So the question how it works seems to be very, very far to be answered. However, as we know, among the computer scientists, there are many specialists involved in the recognition of different net systems. So according what I was reading about it, they distinguish so-called hierarchy organization. And on one hand, they know how to write the computers, how to run the system organized according to hierarchy construction. And as you may guess, on the right side, we can see the attempt to represent a proteins relation following the hierarchy system. Of course, keeping the real biological relations in mind. The answer from the biological side is that really we can recognize the organization of the structure of proteins of the hierarchy category, but it may be applied only for selected so-called subunits. We cannot say that the whole organism represents the hierarchy system. The other one is so-called dispersed system. We can see that significant difference here. We don't have any central government, using this popular word. We have here the very independent modules, the units. Locally, they can be organized in a hierarchy system, like these two on the left side. And once again, the question addressed to the biologist was, is it possible to organize the proteins according to the rules present in dispersed systems? If we have two organizations, we can always build something like a hybrid, like a mixture of these two systems. And here is the one example how to do it. And of course, on the right side, the attempt to organize the proteins following this mixed system of representation. In this, using this philosophy, the most developed, the highest organization of organism which was recognized using this philosophy is the construction of Proteome of Drosophila melanogaster. This is the muszka owocówka. So once again, whatever comment I gave to the yeast proteome is actual, of course, here. So we have a very nice presentation, all proteins using computers. We can magnify certain selected fragment of this proteome, and we can find the very detailed information about connection of two or more proteins we are interested in. Once again, the question how it works. What is the secret of this particular net system on this picture, which makes the system alive? So even despite of the few years of developing this technique, actually this question is without an answer. And now, as I said at the beginning of my presentation, I would like to present our model. Authors are given on the top. And what is our starting point when we started the discussion with computer scientists? What is the main point when you build something like yeast proteome or Drosophila melanogaster? First of all, we must be aware that we deal with the open system. What it means? Every living organism, whatever it is, even a bacteria or virus, is able to be active, to be alive, as long as it is an open system. We are in permanent contact with our surrounding. For example, the most evident symbol of opening system is the consumption, the food we are consuming. And despite of this open system, so we are attacked by many factors coming from our surrounding. The living organism is very mysterious because it keeps permanently steady state. In biology, it is called homeostasis. So on one side, we are open system, and on the other side, there is something inside which makes that the independently in what conditions we are, the system inside is stable. And when you discuss this subject with computer scientists, the answer is just one. In this system, the control system must be active, and even more, this control system must be of automatic character. And the next step is that the only solution to satisfy this main conditions for living organism is the negative feedback loop. So this is the only system which is able to satisfy these two conditions. And I know that everybody knows that the refrigerator is the negative feedback loop, which must have a system which is tracing the temperature in a refrigerator. So this in biology is called receptor. Receptor, this is the element which knows how much of something is allowed to be accepted in a system. The second element of the second part of negative feedback loop is so-called effector. Effector which knows how to run a particular reaction. So receptor is responsible for how much, and effector is responsible how to produce something. And when the production by effector is running, the substrate is produced, and the and the receptor is sensitive to the concentration of substrate, and independently on this concentration, the signal, which is shown here by this dashed line, the signal is sent to effector, making it active, and this process is running permanently. The one negative feedback loop is responsible for what it means. Each negative feedback loop knows which component, which chemical component, called here substrate, which component shall be kept constant. And and going back to the proteins. So what is, where we have here the protein? Receptor is for sure protein. Effector is also protein. Effector is usually, mostly, almost always enzyme. And the next step is a connection between independent negative feedback loops. This connection, as it is shown here, may be realized by two patterns. One is so-called cooperativity, which is related to the substrate for the effector activity. It means that the substrate, which is a component which is transformed by effector, is usually delivered by another negative feedback loop. So the product of other negative feedback loop may play the role of substrate for this one which is on the picture. And the second one is addressed to the receptor. Sometimes receptor, which has its own standard level of sensibility, so receptor knows when to change the on system to the off system, so activity, disactivity. And sometimes this receptor gets the information, and this is usually all the character of order, to change the level on the upper level. This upper regulation is as long realized as the signal is active. If the signal doesn't appear, the negative feedback loop comes back to its standard situation. So in our proteome, we don't pay attention on the length of line linking two units, because our unit we are going to construct our protein is a one negative feedback loop. So this unit may be connected, the connection may be mediated by effector or by receptor. So in our proteome, we distinguish just two forms of connectivity between the negative feedback loops. So our proteome, if we construct sometime, will look like this. Of course, this is just the, the visualization. And of course, if we make one selected unit active, we can get here the as much detailed information as we need. So we can get information which protein is playing a role of effector, which protein is playing a role of receptor, what protein is playing a role of the signal transport. We can localize this process on a cellular level, on a organism level. So for example, we can say which organ, like liver is or kidney, is the place where the particular process is running. we call this unit structurally functional, because on one side we see the structure, so we know what proteins are involved in functioning of the system. And on the other side, we know what is the function of particular negative feedback loop, because we know which factor of the living organism is stabilized by this particular unit. Of course, so far, this model can be applied to the level of organization, which I can call it the chemical organization. I mean, we deal with the chemical molecules. And this models represent the stabilization level. So as we said, in a living organism, the homeostasis is the main point to keep. So this model is so-called, to some extent, answering the question how it works, how it is running. But of course, we shall go to the higher level of organization. These three levels given here are taken from the philosopher Pierre de Latil. So deterministic level is giving the freedom for choosing the method to reach the goal. And I shall finish, yes?
Yes.
Okay, so 2 minutes more. So this is like a level of the neuronal system. So our model doesn't touch this issue. So I just recommend Pierre de Latil, because this is a very interesting approach. At the end, I would like to say that we are looking for somebody who could be able to run, to prepare the computer program. The whole model is presented in this book edited by Springer, where the whole spectrum from the beginning to the end is presented in many details. And the model is also described in simulation, this book edited by De Gruyter, where our model is also presented and discussed. So thank you very much for your attention. And what we are looking for is the person who is able to write the program, computer program, which is able to represent our vision of proteome construction. Thank you very much.
Thank you, Professor Rotterman. This was a very inspiring talk, tackling this time the academic point of view. And I think it's a very nice invitation for collaboration as well. Are there any questions concerning this talk? Okay, I don't see any questions. So thank you very much, Professor Rotterman, again.
Thank you.
We would like to switch gears a little bit this time, and I would like to invite as a next speaker Dr. Oliver Stensel, who's a chairman of the ScanBalt cluster and a board member of the cluster responsible for cluster organization and the head of the ScanBalt Digital Working Group. And this time we'll talk more about the impact that the regional research clusters play in the European health data space. So Oliver, the floor is yours.
Thank you very much. Carolina, can you hear me?
Yes, we can hear you.
And can you see my screen?
Not yet.
I will start the slideshow. Is it visible?
Not yet.
Okay. If not, Carolina, could you please share your screen? As I already mentioned, I always have some problems with Zoom.
Yes, let me. let me try to do so. Okay, can you see my screen this time?
Yes.
Yes, perfect.
Okay.
So
The
thank you.
slideshow does not really want to work for whatever reason. I'm not sure why is that so.
If not, we take this version. It's okay, I think.
Okay, I'm so sorry, but I cannot make it happen unless I try something different.
Okay, in the meantime, I will begin. Thank you very much for inviting me. Thank you very much to have the possibility to talk about ScanBalt and our joint declaration on a common European health data space. Just to give you a short background, I am head of the ScanBalt working group on digitalization. ScanBalt is a cluster organization from the Baltic and Baltic Sea region, mainly driven by the Baltic and Scandinavian states, those states who are very advanced in digital health. And that's the reason why my company Novartis joined ScanBalt for getting a closer contact to these regions to see what's happening there and what effort they are doing on digital health. Perhaps, Carolina, we go on with the next slide.
Unfortunately, I seem not to be able to do anything with the slides as well. Maybe, Grzegorz, could you please share the presentation? Maybe you'll be able to do so, because it seems like I got stuck.
Yes, give me a while.
Sorry for that.
No, sorry, I'm the source of problems.
No, I'm not sure what happened. It's just the PowerPoint didn't let me do anything.
Okay.
Oh, perfect. Thank you.
Oh, this looks good. Okay, so then we can go on to the second slide. Yes, just to give you the background, this ScanBalt Joint Declaration was an initiative we brought forward during the German EU Council presidency. As you know, the whole just finishing this December German Council presidency was predominated by the COVID-19 crisis, but we had a lot of additional health topics on the agenda. One of them was the EU digital health data space. So our German government was concerned from the beginning that we need a more active part in Europe to bring this digital health data space forward. And in my view, the COVID-19 crisis was just another occasion to see how important this digital health data space is and how important it is to bring cross-border cooperation forward, to share data within the European Union and to get a common point of view how we will treat health data in research and also in industrial research. Next slide, please. Yeah, this is the reason why we organized this pan-European conference on digital health. It took place on 4th of September. Sano was also a supporting partner. And you can see here on the map that we invited clusters from all over Europe to bring on their best practice examples, how they treat the COVID-19 crisis by digital means. And what we wanted to express with this conference is that we already have a European health data space, but we have it fragmented in the different cluster organizations. We do not have this common view on digital health, but we have a lot of examples who show that we are already started to share data cross-border, that we already have a huge exchange between research clusters on digital health data, and that what we need now from the European Union is a common framework to bring this single examples together and to give them a common framework, to give them more security, how they can share data together and how they can treat personal health data in special. Next slide, please. Yeah, the result of this conference is a joint declaration. In this joint declaration, we describe the current situation. We show on bottlenecks and give possible solutions, what the European Union can do to create this common European data space. And we submitted it to the German Council presidency as a voice of the civil society. So we showed that it's better to look at the cluster organizations, at those people who are dealing with research data every day, to get another view on this topic. It's better than just only to discuss it by political debates. Just get into the practice and see what you can get, what recommendations you can get from it. And what we always also try to establish is that the upcoming council presidencies, this will be Portugal and Slovenia in the next 12 months, that they could also pick up this initiative, because we know that the creation of the data space is nothing that the German council presidency could resolve on its own. It's an ongoing process, and this will dominate the next year and even the next 2 years of the European debates. When you look at the flags, you see the diversity of the countries contributing to this conference and the high impact this will have on a European level. And I think this is the main benefit that we will have from this joint declaration, that it brought together so many different countries and so many different points of view on this topic. Next slide, please. I will pick up 3 tasks from this declaration to give you in this short time an overview about our main topics. I think these are really relevant points. We talk about data privacy, about interoperability, and this political debate about strengthening European institutions, which I think is really necessary to give back the confidence to the citizens on data, health data. You need European institutions who have an overview about the dealing with data in the European Union. If you could go on the next slide. Yes. When we talk about data privacy, we really highlighted that all European citizens must have access to their electronic file according to GDPR, and that all citizens should be allowed to share their data with authorized partners. So that is it's the will of the citizens what happens with their data, and this should be really highlighted by institutional reforms and legislative frameworks. Data protection is the highest goal we have in Europe, and even from an industry perspective, or especially from an industry perspective, every citizen must be completely sure that the data privacy is secured, because without data privacy, in our view, you will never get good data. So if you want to do data research, and if you want to give more importance to health data, this only can work if you have really data privacy and data protection. Without this, you will never get the quality of data you need for doing good research with it. And this is why the protection of the patient data is on the first step of every political initiative we do. And as you know, we have a lot of data privacy regulation in Europe, but we do not have a real common data privacy regulation. The GDPR is a good framework, but we have to bring it forward so that it's more an enabler of sharing data and not a burden of cross-country collaboration on data sharing. If you can show the next slide. interoperability, of course, the main aspect when we talk about exchange of data and cross-country collaboration. The EU is the institution who has to agree on uniform international recognized and tested standards. So we need the active initiative of the European institutions to guarantee interoperability. This is particularly relevant for any research and development, and even for when we now talk about recovering the European economy from the current crisis. I think interoperability is the main precondition for more active European industrial policy, not only on research but also on economy. So I think we have now at this stage of the debate good examples and good arguments for demanding more interoperability, and to really use data in the sense of guaranteeing efficient prevention of diseases, prediction of diseases, and treatment. Researchers and life science industry really rely on the connectivity to other institutions and to universities, for example, or to smaller startups. Even their knowledge is highly relevant for the development of new treatments. So interoperability must be really the main goal of every instance now. When you look at the tracing apps, I think this is another good example how we can show to the European governments that without interoperability, this whole tracing app system that we established in the member states to deal with the crisis and to even reinstall flexibility of movement in Europe, these tracing apps, they make no sense if they are not interoperable. And I think even the last interested persons in digital health can understand that with this tracing app example, the importance of interoperability. Coming to the next slide. As I already mentioned, we need strong European institutions to give us the frameworks and the guidance that everybody needs. So we need, when we come to crisis management, we need this ECDC as a really powerful European institutions to coordinate capacities in the member states to respond to the crisis. But when we go further and we think about European data space after the COVID-19 situation, we need a European publicly accessible medical database to really use all the power that we have in digital health. And these digital registers of medical supply are really important, and they must be coordinated at a European level. Even for cross-border healthcare, when we talk, for example, about sharing hospital capacities, which is in the current crisis situation, and perhaps we do not want to think about it, but we will have, I think so, further waves of COVID-19. So we have to think about better coordinating hospital capacities within Europe. So this is impossible without a really digital hospital, European hospital system. So we also need in this space more activity of the European institution. And in our view, to bring together these good best practice examples we already have, but to bring out the right conclusions of it, we need something like a monitoring report that brings together the state examples and give an overview what's going on in digital health in Europe, and picks up this best practice example with this, for example, BNL reporting tool, and to make it available to the other European actors and institutions to agree on a common way of bringing forward digital health in Europe. And the last, but for us really highly important point will be that we must empower the European citizens to treat the data. And so we need something like digital health literacy to empower those citizens. So we need European-wide support programs for empowerment of citizens to inform about the capacity of digital health, to inform about the data rights of every citizen, because this is the only way of creating the trust we need, that people are decided to share the data, and that they have the impression that data sharing is not something research institutions need for their own purposes, but that every citizen needs for its own health, and that is in the favor of every citizen that he has the possibility to share its data with others. I think this was my last slide. Yes, it is. So thank you very much for this information, to give this short overview about our ScanBalt initiative. And I would like to put in the chat the link to the ScanBalt declaration for everybody who is interested in have a more deep insight and even interest in supporting this declaration. So I highly would appreciate if you could support it and have a deeper look into it. So Carolina and the rest, thank you very much for this opportunity.
Thank you, Oliver. That was very important talk, in my opinion, especially in times like we have right now, where we're facing extreme situation, and probably having all the data would be much easier to control the situation. But it's also very important to know that European health data exchange is not only important for scientific purposes, but for clinical purposes, as we've already learned before, and would definitely facilitate the situation around the world. Are there any questions to Oliver right now? I don't see any. So thank you, Oliver, again. And here I would like to invite Dr. Andrew Narracott, who's a senior lecturer at the University of Sheffield with over 20 years of experience in EC and international research projects, and is a Sheffield's principal investigator for the SANA project, coordinating the contribution of Insignio Institute in facilitating SANA to develop and translate innovative solutions for computational medicine. Andrew, the floor is yours.
Thank you very much, Carolina, for the introduction, and thanks to the organisers for giving me a chance to talk briefly about SANO this morning. As Carolina said, I'm from the University of Sheffield. I'm giving this talk on behalf of partners of the SANO consortium. And the aim of this talk is to extend some of the topics that Marion covered earlier in the session to talk specifically about international collaboration. I will switch off my video during the talk, and then I'll bring it back on for questions at the end. Okay. So the focus here is on international collaboration, as I mentioned, and to place that within context, computational medicine, which is the focus of this SANO effort, covers a wide range of technologies. And because of the development of these technologies, many of them are at varying levels of maturity. The advantage of this is that there are significant opportunities for exploitation, taking these technologies from the initial research into the marketplace. And this is interesting because that's obviously a commercial perspective on the problem. From a research perspective on the problem, it's essential for us to translate these tools in order to have sustainable healthcare innovation. If the tools remain as research tools, we can't sustainably use them to do clinical research in particular. Sano is uniquely placed as a regional hub for international collaboration, and this gives an opportunity for people that are interested in taking up these opportunities within the region in Poland and more broadly in Poland to engage with the international partners within the Sano Centre and within the Sano EC funded project. And as has been mentioned already, one of the key features of Sano is that it's supported both by national funding at the Polish level and also by broader EC funding, which helps to fund international participation. So I'm going to talk about some of the international expertise that's associated with the Sano Centre. And if you're interested in that, I'll also provide some details at the end for further information. So one of the issues with computational medicine technologies, Marian's already given an overview of this earlier, is that it requires expertise from a broad range of sectors. I'm not going to go into all the detail today, but this diagram gives an indication of all the different areas that need to be covered to take an idea from the initial research through to clinical and commercial exploitation. And Sano is well placed. Sano is already developing a team to cut across all of these areas. So what I'm going to do in this talk is illustrate the international partners and say how they contribute to these particular areas. Okay. One of the issues here is that events like the Life Science Open Space are essential to make sure that the development of these solutions is aligned with market needs. And the Klaster Life Science Kraków, who are hosting this event, of course, are providing this support for Sano in terms of outreach and business development, making sure that the right stakeholders come into the process and get an opportunity to guide technology development throughout the process. What the cluster also does is allows Sano to clarify the offer that it can make to industrial partners. If you're an industrial partner and you're interested in collaboration, then there will be some contact details at the end of this presentation. So moving on to the international partners, one of the key partners is Ciphernet. Ciphernet have a strong track record in the delivery of computing infrastructure, particularly through Marian Bubach's team. There's a number of projects here which are both national and EC level projects. And a growing number of those have focused on support for medical applications, the underlying computational infrastructure for those. And this has led to a reputation for excellence within Marian's group in supporting HPC and big data projects with medical use cases. And many of these projects have been realized in collaboration with the University of Sheffield and the Insignio Institute. So this slide provides an overview of the Ciphernet mission in terms of the track record and the capabilities. Key things to focus on here are Ciphernet's participation in several national and international HPC initiatives, their role in management of supercomputing infrastructure, leadership in the development of strategy and policy for e-infrastructure. And it's worth noting that this covers both research and training, particularly around the development and delivery of bespoke software tools for HPC applications. So this slide here allows us to look at how Ciphernet maps to the areas that Sano is addressing. The focus, of course, here is on infrastructure to support computer science technology. An important point is deploying this at the production level rather than at research level. And this is essential if we want to promote development of these techniques from the academic concepts to scalable solutions that can be commercially deployed and exploited. An important feature in the design of the Sano consortium, when we were putting in an application for EC funding, was mutually beneficial interactions between Sano and the partners that contribute. And there are some examples on this slide of the complementarities between the track record that Ciphernet has and the unique collaborative opportunities that are offered by Sano. So moving on to the University of Sheffield, as already been mentioned, the partnership between Ciphernet and Sheffield has been inspirational for the positioning of Sano. And then another example of this interface between engineering and life sciences is the fact that in Sheffield, we formalize this through the establishment of the Insignio Institute for In Silico Medicine. Insignio involves around 150 senior staff, both from academic and clinical backgrounds. And importantly, it's a joint initiative between the University of Sheffield and the local teaching hospital trust. And there's some other examples of Insignio expertise given on the slide. The Insignio approach is to achieve impact through translation of academic research to the clinic and involving industrial collaborators through appropriate funding mechanisms and collaborative schemes. This slide demonstrates some of the areas of strength within the engineering, medicine and healthcare domains. Insignio maps very closely to the interests of Sano. One of the exciting opportunities that's afforded by Sano is the chance to take the development of computational medical tools beyond the typical academic stages that would normally be associated with academic research. And that's a key focus of the partnership between Insignio and Sano. Insignio members cover a range of research domains, both technological and clinically focused. Here are some examples of recent research, including mechanobiology of bone remodeling, vascular biology using zebrafish models, and computational techniques to aid decision-making and coronary intervention. I'd strongly recommend that if you're interested in taking a deeper look, that you have a look at the Insignio website, which provides many more examples of the focus of the research. Moving on to our next partner, this is the Forschungszentrum Jülich, which is a center of excellence for development of hardware and software for high performance computing. And this includes the Jülich Supercomputing Center and the Institute for Advanced Simulation. Jülich provide both access to supercomputers, but also a focus on technology developments in cooperation with industrial and academic partners. This includes development of new computational architectures, innovative networks, accelerator processors such as GPUs, and novel computing approaches, including neuromorphic computing and quantum computing. This slide provides an overview of some of the capabilities which Jülich can offer, specifically the role in development of hardware for quantum computing and preparing for the production exascale supercomputing systems. The Supercomputing Center and the Institute of Neuroscience lead a sub-project within the Human Brain Project focused on the HPC platform. Jülich have expertise specifically in community-oriented research services and support units, several of which target biology, medicine, and biotechnology. And this is particularly interesting for Sano in terms of providing domain-specific support for HPC access. Jülich maps to Sano with a focus on state-of-the-art HPC infrastructure, along with engagement of end-user groups in the life sciences domain. And a key focus here is lowering the barriers to engagement with supercomputing resources, and that includes aspects around data management approaches and the training provided to researchers. Jülich, along with Aachen University, contribute to the establishment of Sano support infrastructure. This is achieved primarily through the simulation laboratories at Jülich Supercomputing Center, which provide a blueprint for this type of activity. On this slide shows several examples of the kind of expertise and the contribution that Jülich are making to Sano development processes. Our colleagues Fraunhofer provided some information at the start of the session, and again, I'd like to highlight the opportunity there for participants to become involved in Sano through engagement with the questionnaire process. The Fraunhofer mission and capabilities are summarized on this slide. The focus here is on assessment of emerging technologies, definition of strategies to accelerate translation to the marketplace, consultancies to support responsible development and innovation. Fraunhofer provide a unique insight into the landscape of research and innovation through their links with R&D institutes, participation in over 400 projects each year, and their broad staff expertise. Fraunhofer maps to Sano with a focus on product development, management of the innovation process throughout the research life cycle, and engagement with end users, particularly around needs analysis to inform strategic planning. And again, things like the survey that's been promoted are a mechanism to support Sano in doing that. In terms of specific Fraunhofer support for Sano, that's shown on this slide. That focuses on strategies to assess the evolving landscape of healthcare innovation, monitoring techniques to ensure that Sano remains aligned with developments within the marketplace, and provision of training to foster innovation skills. A lot of the focus of the partners is around ensuring sustainability as Sano grows and develops its activities. So we hope that this talk has given a brief flavour of the opportunities afforded for international collaboration as part of Sano. There's some contact details on here. Carolina, who's been chairing the session, should be the first point of contact if you're interested. I'd also like to reiterate what Marion has already mentioned, the Sano seminar series, which provides an opportunity to see some of the areas for international cooperation. And at the bottom of the slide here, there are further details of the partners that have been mentioned in the talk today. So thank you for your attention, and I'd be very happy to take any questions.
Thank you, Andrew, for this splendid summary of the capabilities of Sano partners and opportunities for the collaboration. Are there any questions for Andrew right now? Okay, I don't think there are any. So thank you again for this presentation, Andrew. It's been a great pleasure and a wonderful closing talk, I would say. I would like to also encourage everybody who participated in this session to take part in collaboration and reaching out to all or each one of the speakers if you're interested in any particular area of collaboration. You can do it through the matching platform provided by the organizers, or you can just contact me directly if you need any information how to get in touch with any of the presenters. And here I would like to say have a good afternoon already and give the microphone to Kazimierz.
Hello, everybody. Thank you to all presenters and also for the leader for having this session. Also, great thanks to translators. They did a great job. I have had an occasion to listen to that. Just for your information, in between, we have placed the links to the survey mentioned in the second presentation by Lilia, and you can find, if you take part, what we encourage you, take part in this survey and share this survey with others from the sector. You can do it either going to the website, Life Science Cluster website, where the session Digital Health has been presented, all presentations, all abstract of the presentations, or go to the Digital Health section on the B2 Match platform, and you'll find the links over there. And now, continuing the subject of digital health as a broader sense in the domain of personalized medicine, I would like to invite you tomorrow for the tomorrow's session, which will be led by BioMunich, and which will relate to medical technologies, and also which will be very interesting in terms from the perspective of collaboration. This is in the domain of personalized medicine, and today afternoon at 3 o'clock, I invite you to participate, those who are interested, of course, in the session Healthy Food. We start at 3 p.m. till 5 p.m. Don't forget about using the other options of the platform, which is the partnering opportunities. Now you can reach all presenters and invite them to meet with you, or you can try to do it between yourself as a participants, and also take a look at the marketplace. There are some interesting offers over there related to digital health. Thank you very much again, and see you either today afternoon or tomorrow morning. Tomorrow morning at 10, today afternoon at 3 p.m. Thank you very much. This is over for now.
Thank you.